get started with this afternoon's proceedings. We have Indiana Economic Development Corporation, Mr. Basso. The floor is now yours. Thank you very much.
That he is running. So he will be here tomorrow to present on the other half of our budget request. So just a reminder, IEDC, our big goals, we operate at the speed of business. We help streamline, we're a streamlined agency helping to do business development throughout the state, internationally, also include the Indiana Defense Network that came over last year. And really our mission at the IEDC is to tell your story. Right, the great work of past General Assemblies, past governors, current General Assemblies, of all the things and tools you provided us. So when we meet with businesses, we can tell them about the pro-growth business climate we have, our corporate tax rate, individual tax rate, and the only time we like to say no. No inventory tax, no inheritance tax, no income tax, the affordability of the state, and then the bottom three, the thing we hear the most from businesses that they love. Balanced budget, AAA credit rating, and a right-to-work state. These are many reasons why people are picking Indiana to grow their business or to bring their business to the state. So some of the rankings that we have that we hear a lot from businesses that are important to them. Number one in the Midwest for business, number one for government efficiency, number one airport in North America always comes into play. Number one infrastructure. As we meet with companies all throughout the country, we're probably the only state, if not the only state, that has a fully funded road plan, and that means a lot to businesses because they know we're going to continue to invest in our state. So before I can tell you about all the great things we've done traditionally with IEDC, just want to take a few minutes to go over our COVID response. So we update these numbers quarterly, and tomorrow's our new quarter, so some of these are a little different. But for those of you that didn't know, the IEDC took on the responsibility of purchasing PPE during the pandemic. Over 70 million pieces of PPE purchased, about 70 million received. During that time, we really relied on the state's manufacturers to make PPE. So 16 manufacturers started making PPE for the state. Nine of those companies opened a PPE line. 90% of the world's PPE comes from outside of the United States. So as the world was going through a pandemic, it wasn't just Indiana, it was everywhere across the world. So in order to get ourselves through this pandemic, we had to have Indiana companies step up and help, and they stepped up. We also opened a PPE marketplace, over 31,000 PPE bundles sent to Indiana small businesses, representing about 600 cities and towns. We opened a PPE directory, a direct website for Hoosiers to go to and know they were buying trusted PPE. I tell people all the time, and they think this is a hard stat to believe, 9 out of every 10 companies that called the IEDC were either a scam or were getting scammed. There was all kinds of counterfeit materials out there, and it was really, in some ways, it was really great how many people were helping. Some ways it was pretty disappointing. 588 schools received 2 rounds of PPE shipments coordinated by the IEDC. This was reusable mask, surgical mask, hand sanitizer, face shields, and anything else they may need to help open their schools safely. One of the companies I wanted to highlight about a company that became a manufacturer of PPE was Indiana Face Mask. They're out of Rensselaer. They just got approved to make N95 respirator mask last week or 2 weeks ago by the CDC. Currently in the United States, there's 6 companies that do this. There's 25 companies worldwide that do this. There were 18,000 submissions to the CDC to get approval. They were one of 5. They went and bought the machines from China, brought them here, took them apart, remade them, and actually made a better machine. Fred Geyer, Clayton Geyer, his wife Stephanie, they're doing something that a variety of people told them they wouldn't be able to do. So as Hoosiers, we should be really proud of Indiana Face Mask. And one of the reasons why the IEDC was able to pivot and go out and buy PPE and find PPE was because of the flexibility the General Assembly has given us over the years. When I took this position in February, I had no idea I would be buying PPE, but when we had to start doing it in March, we had the flexibility to go do it, and I think we had a pretty good response based on what I've heard other states doing and based on what I've heard from hospitals. So here's our fiscal year 20 and 2021 budget. And then here are some tools that you, the General Assembly, have given us over the past 2 years that have really helped us continue to help break records and help set job commitments. And a couple to point out on this part. One is our data center tax exemption. Prior to this legislative change, we were in the bottom 5 of states when it came to attraction for data centers. Now we're in the top 5. We've had a couple data centers come online this year, and this is a big win for the entire state. So a little bit of a review. 2019 here, oh, sorry, I think I got a little clicky, apologize for that. 2019, here are our numbers in review. 296 projects. We had $8.4 billion in investment to the state of Indiana, which was a record. Just over 27,000 jobs committed to the state of Indiana, and our wage was $28.60, also a record. So in 2020, even though we're in the middle of a pandemic, companies still continue to pick Indiana. We've had 265, so these numbers are as of Friday, so to give you an idea of how hot we are right now in Indiana with companies picking this state, these numbers are at Friday. We had 265 commitments. So what, that's 3 days. We've added 14 projects in that timeline. We're at 279 projects now for the year. Our investment, just over $5.6 billion. We've added, we're now at over 31,000 jobs for the year. We're 75 jobs away from the record. And then our hourly wage has jumped up to $28.06. So companies are picking Indiana, and they're picking it because of our great government to work with, our tax environment, our regulatory environment, and all the other tools we've been able to talk about today. So next, this is our jobs realization, right? It's only as good as what comes true. So Emily's gonna take Emily Chris from our office is gonna take a few minutes to walk through these numbers.
Absolutely, thanks, Luke. So every year we engage a independent third-party accounting firm to go over the projects that we have active in our pipeline, and those are available through the transparency portal. And these are, again, independently developed and certified. 2018 is our most recent jobs report. The new one will be out in February. In 2018, our active contracts, we had 1,804 active incentive contracts, 1,044 and 31 cumulative expected new jobs by the end of 2018. Those are jobs that are in our contracts based on the ramp-up period. The cumulative net new jobs, or those that materialized, were over 131,000 new jobs. We committed total incentives of just over $79 million. Those jobs represented a new payroll of $6.1 billion, and the net benefit to the state, which is going to be income that would not have come into the state but for these jobs, was $109.8 million.
And I also think it's important to highlight again that these are all performance-based. The companies have to perform in order to collect the incentives. Here's our 2017 to 2020 success. As I mentioned before, every year over the last 4 years, we've broken a record in either jobs, investment, projects, or hourly wage. So again, thank you to the governor, thank you to the General Assembly for everything that they've helped us accomplish during this 4 years. I want to take a few minutes to touch on our innovation and entrepreneurship division of the IEDC. This is a place where new businesses grow, or existing businesses are helping to make investments in the ever-growing environment we live in today. That division is highlighted by the 21 Fund, which are ecosystem development, which we're looking for reasonable returns, and we've had some really great returns on our 21 Fund that Emily's gonna cover for us.
Yeah, absolutely. So The efforts that we make in investments is creating an ecosystem throughout the state. An ecosystem is essentially an environment where new businesses can thrive, or businesses that are already existing can have the tools to revamp or continue their operations. So we're seeing some really excellent success through a few of our technology adoption initiatives, including the Indiana 5G Lab, which is a partnership with AT&T, Verizon, and XQ Messaging. We have an event co-hosting soon, I think this week. We also are really proud of our autonomous challenge and being designated the first future mobility district in the country. Indy and Fishers were selected as this first future mobility district. So we're really excited about the first shuttles beginning in May 2021. And then finally, we are working on the build out of the EMC Squared Lab. And this has leveraged partnerships to raise over $3.5 million, and we are continuing to find new partnerships throughout the state.
Thank you, Emily. And one I wanted to highlight is Techstar Sports. This is a partnership with the Indiana Sports Corp, the Pacers, the Colts. Every year, 10 companies come to Indianapolis to help launch their business. This year, we're proud to announce we have 2 of the Techstar Sports companies who are now picking Indiana to open their manufacturing headquarters and their company headquarters. So one of the reasons we get asked a lot about what we're doing for innovation, what we're doing for entrepreneurship, what our big goal, one of our big goals of the 21 Fund is, we know as a state we're manufacturing heavy, right? We're the #1 or #2 state when it comes to manufacturing, depending on the day that the rankings come out. And we know that in order for our state to continue to be so great at manufacturing, we have to continue to make investments in our manufacturing companies. So one of the things that came out of the pandemic was we knew there were a lot of companies who were continuing to do business overseas, and we needed to have a program to help with onshoring. Right? We wanted to bring this back, so if we're ever in any type of pandemic or any type of supply chain issue, we're worrying about the drive from Lebanon, not the drive from Guangzhou, China. Right, so we want these jobs here, we want these companies here. So in May, we launched our Manufacturing Readiness Grant, which is a matching grant for manufacturing companies throughout the state. Without this grant, we would have never got Indiana Face Mask, who has helped provide hospitals and schools with this. We would have never got SHK hand sanitizer, which helped, again, schools, everybody else get everything they need. But most importantly, we've invested about $6.7 million into our manufacturing grant. We've received a 7 times matching ratio on that. So about 87 grants have been approved to date, and that impacts about 57 different communities. Communities such as Fort Branch, Indiana. Communities such as North Vernon, Jasper, Angola, Winnemac, all throughout the state. And this has been a program that we've been partnered with Connexus Indiana on, who did a report last year about our manufacturing health and how we need to improve. And Connexus really hasn't had a chance to market it all that much because it's been so popular and so many people have been calling us about it. So this has been a great program for us, and we're really excited what's going to happen with the future. One of the other questions we get, what are we doing to support small businesses? So we have 2 distinct divisions within the IEDC that are there to support small businesses. Our Indiana Small Business Development Center and Indiana Procurement Technical Assistance Center. And since PTAC always trips me up, I'm going to throw it to Emily to give you our statistics on that one.
Great, thank you. So we're really proud of our small business support at the IEDC. PTAC this year has gotten almost 400 new clients. 419 jobs have been supported through their operations. 4,180 federal contracts have been awarded to these businesses, and that reflects $349 million in federal contracts. We also are proud that PTAC has assisted 30% women-owned businesses, 22% veteran-owned businesses, 12% service-disabled veteran businesses, and 16% minority businesses. ISBDC has also been a major part of our efforts with small businesses through the COVID-19 pandemic. ISBDC has assisted over 3,000 unique businesses this year with COVID-19 related counseling and services, and that's about 13,000 hours assisting entrepreneurs with services and advising to help them recover. The numbers that we see here for SBDC are from last quarter, so I'm proud to give you our most recent quarter of data for ISBDC. They have helped create, even despite the pandemic, 309 new businesses. That has created over 2,000 new jobs, resulted in $101 million in capital infusion, and they have counseled over 5,000 clients. We are also proud that they have really been making a concerted effort to engage more MBE and WBE businesses throughout the state. They have recorded 50% women businesses in their new business starts, 17% minority businesses, and 39% rural businesses. We also have similar astounding numbers through their clients served and training attendees through ISBDC. We're also really proud that ISBDC has some really interesting new efforts in the pipeline. One of those is Project Hope, which connects businesses that have been affected by the pandemic with students from IU Bloomington to help their digital transformation during a time when online shopping, online presence is so important. 24% of those completed projects were with minority businesses. ISBDC is also working to include translation services throughout all 10 of their offices statewide, and also they are working to introduce advisors outside of normal business hours for entrepreneurs who are unable to make the 9 to 5 regular business day hours.
And something else that ISBDC did that I forgot to mention, they were also the organization that handled our PPP loans as a state. So $9.5 billion passed through SBDC to 83,000 Indiana small businesses during the initial phases of PPP. And then on top of that, through our own Restart grant that we launched at the IADC, about $6.3 million went to 882 companies during that time. So SBDC was able to grow their numbers significantly during those times, all while also doing the PPP. SBDC is a division of SBA. That's why they're the ones that handled it. They have a number of people throughout the state, but we've seen a lot of great success since they've come over to the IEDC. So we're always looking for ways to become a more diverse workforce and continue to grow a dynamic workforce. Obviously, we've seen some population growth over the last few years. We want to continue to invest in our communities, and most importantly, we want to continue to create a 21st century talent pool that companies choosing Indiana continue to select Hoosiers from. So I think that is all I have today, and I want to say thank you again for hearing us, and we're always, we love to work with the General Assembly, and happy to answer any questions you guys have for us today.
Question, Senator Brown.
Thank you, Mr. Chairman. So looking on page 18 of the packet, not your slides, with the budget proposal at the 15% reduction, am I correct that the reduction is in 21st Century, the Skills Enhancement, Office of Defense Development and Economic Development Grant and Loans? Is that where the...
Yes.
And I'm curious how you prioritize those. Some remained intact, for example.
Yeah, so we sat down with our fiscal team and our divisions and walked through, obviously with SEF is a fund that can continue over a few years because the commitments can be, we could commit somebody to Skills Enhancement Fund today and they may not utilize it for 5 years. So if for some reason, a program fell off or job commitment didn't happen, there was room to bring those funds down. And then the same on the 21 fund, we had some projects that were in there that because of COVID are no longer going to happen, or they're going to happen a few years out. We saw those as a chance to go ahead and back that down, because we know we're not going to use them in the next 2 years.
Okay, and I assume the Orange County RED was not included, even though it's because it's a pass-through, it wasn't included in the 15%.
Correct. Sorry, Senator, I just want to make sure it was not included in.
Right.
Yes, correct.
Okay, and then on your slides in supporting small businesses, and congratulations with the successes in this trying year. I'm curious, though, I always ask these questions of economic development entities. Do you keep track of the losses, and did you have any job losses with those with whom IEDC had contracts?
So if we have incentives with them, we will then track it. But sometimes because of the realization runs about a year behind, we won't have that. We won't exactly know until about a year from now. So as Emily mentioned, what was in here was our 2018 realization. We'll finish our 2019 in February. We have had some companies reach out and say because of the pandemic, they are slower to meeting their job goal, and we do have those types of conversations. But if a company were to close today, we may not necessarily know about it right away.
Right, but do you track it, and do you give us a report of that? Because I'm not seeing it.
So in our jobs realization report, as Luke mentioned, we are able to tell when our account managers work with the businesses to ensure that they are meeting the goals as set forth in their contract. If they have reduced operations or ceased operations, that's when that kind of tracking would take place. Our account managers are in frequent communication with the companies that we work with. We also are clued in when a company files a warn notice, so we track that as well. As far as small business, our advisors work with the businesses as they're starting out, and I'm happy to ask our team if they track if small businesses close or reduce operations. But since we're mostly on the front end of those efforts, we don't necessarily have the incentive follow through like with our tax credit awards.
Right, I appreciate that, but I would like to have the information before as to the losses and those that aren't able to keep up, no matter what the reason for.
We can pull that for you.
Thank you. I'm curious for the most recent big announcement you had down here in the Indianapolis area with the Alon project. So IEDC was a significant part of that.
Mm-hmm.
And the $25 million or so land purchase, which fund did that money come out of?
So Secretary Schellinger is actually going to come tomorrow and present on that portion of how the funding will work on that one. He's here tomorrow on that part.
I'm just curious on your budgeting, which
Sure.
of these?
Without getting too in the weeds for his presentation tomorrow, a portion of the amount is coming from next level flights. And then we are, because some of our activities that were set aside in the Business Promotion and Innovation Fund did not happen because of the pandemic, we were able to move some of the funds from, some of the money from that fund to this effort.
Did you say next level flights?
That's correct.
So, for example, I remember a couple years ago, the direct flight to Paris would have been included in that sort of thing?
That's the type of effort that we're looking for there.
Okay, so because of this, we have transferred, and you can do that without legislative action?
We are coming to Budget Committee tomorrow for approval to move those funds.
Okay. And then I'm sure it's a pretty small, but this Techstars Sports Accelerator, I believe I heard you say 10 come every year, 2 picked Indiana. How much is spent on that? And are those 2 that picked Indiana, are they just here in Indianapolis? And how many jobs is that? And what does that cost, that program?
We'll get you the exact number. It comes from the next level fund on the investment. So I'll get you the exact number, and then on the 2 that picked, we'll get you those exact numbers as well. One company is still evaluating sites. It's going to be a manufacturing facility, so they're looking at a variety of different spots in the state right now. And then the one that was just picked, Indiana, I think that one is going to be in Indianapolis.
Great, thank you. That's all the questions.
Senator Mishler.
Mr. Chairman. Senator Brown, so I was involved in that discussion, so it came up that when we put the money into the flights with the COVID, they weren't going to really have any use for the money with the flights the way they are. So we just say, we'll say we suggested that if on this Elanco deal that they use their resources they already have within IEDC, and felt that since they weren't going to use the money for the planes, that they should be able to use it for other investments. So that's how that all came up.
Senator Faddy?
Thank you, Mr. Chair. Thank you for your presentation, and I appreciate your hard work. It's difficult to try to attract businesses during a global pandemic, so thank you for that. Two quick questions. The first, just using 2018 as an example, you listed that there were expected 144,000 expected new jobs, but we recognized 131,000 actual jobs. So there's a delta of like 13,000 jobs. In that instance, as an example, as a case study, did you claw back incentive dollars that the state allocated or tax credits, or how did you deal with that? And if so, do you have like a ballpark figure of what that amount could be?
So we do track our clawbacks, which we can get to you. I can't say specifically on this one because if the 13,000, if they were, because it's performance based, right? So in that instance of all 13,000 were edge credits, then there was no money paid out, no money received. If it was something else other than that, then we do go through a pretty extenuous clawback situation, but we can get you those stats on what our clawbacks are.
Appreciate you. The second question, I think last time I checked in terms of the numbers of new jobs that we attracted, and I'm not sure if it's for 2020. I think I've heard the governor's office speak about, roughly speaking, 35,000 open jobs, I think, in Indiana. And maybe I'm not sure if that's
maybe a little higher than that, but yeah.
Maybe a little bit higher than that. And we have a gap between the skilled workforce that can fill these jobs. So from a strategic perspective, how do we balance investing tens of, if not hundreds of millions of dollars of attracting jobs that we can't fill because we need to invest in upskilling the workforce? Does it make sense to channel some of these investments more towards the skill development? How do you strike the balance between keeping jobs open versus investing in the skill training piece of it?
Yeah, totally. I think the first way you strike the balance is the performance-based, right? Got to give the companies a reason to go out and skill up their workforce. But something we've heard more recently is about talent and how do we get it. And we're here to be a partner with companies. Obviously the company's ultimately going to have to solve it, right? No matter many projects we put in there, they have to train, pay, and retain. But I think right now we're pretty close to a good balance because of the performance-based incentives we use. But we've heard over the last year about how workforce is continuing to be more of a problem. That's why we've seen us work closer with Teresa Lubbers and her group, the Workforce Cabinet, Fred Payne, PJ McGrew, and we're starting to have more and more of those conversations about where training dollars should go, how do we better utilize them within our companies coming here. And then most importantly, we know we are having people who are getting trained. Then how do we connect those people to the companies in different parts of the state, right? Elkhart has had a lot of jobs announcements right now, and a lot of people are working. We need more people in Elkhart, so how do we facilitate those conversations to get people to travel to work better jobs?
I appreciate you. As a comment, I look forward to supporting my colleagues in both the House and the Senate to support our economic development activities in the state of Indiana. In my district, I know that many small businesses are hurting at this point. They lost many of their employees, and we need to continue to keep Indiana a place where our small businesses continue to thrive. So I look forward to working with you, with the Indiana Chamber and Indy Chamber and other chambers to be sure that we keep that competitive business environment for our state.
And as a constituent, new constituent, I look forward to working with you.
Appreciate you. Thank you. You're my boss.
Senator Melton?
Thank you, Mr. Chair. Just a couple of questions in regards to, excuse me, the PPP loans. Do we have a report or a summary of how many businesses in the state of Indiana was approved for the PPP loans, and how many were, I guess, forgiven in the state? I know some loans were forgiven. Is there a report that's public or?
Yes, so we have information about how many loans were approved for Indiana businesses. We have about $9.5 billion from PPP coming into the state, and then add another about $1 billion in EIDL, which was kind of the partner SBA loan. We can certainly pull how many businesses were forgiven.
Right.
were forgiven through those programs. But we've seen really tremendous success. That information all comes straight to us from the Small Business Administration at the federal level, and they typically put out monthly or quarterly reports on those items. We'll certainly get those to you.
And Senator, from the PPP, 83,246 Indiana businesses received it.
Okay. What's that total amount in terms of overall funds that came in?
So what's the percent, like how many?
How much total funding?
9.55 billion.
Got you.
Yes.
Okay, thanks. A couple other questions in terms of, similar to what Senator Fatty was saying, are you hearing anything specific from small businesses in terms of their need in the pandemic? Is there something that you're hearing specifically?
Yeah, so I think there's probably a good divide here. So it's not so much small business versus large business, it's more sector-based, right? So restaurants, hospitality, they're retail. We're here in some cases, ones that don't have an online presence. That's who we're hearing from the most. I think there are a lot of small businesses we're hearing from that are in the manufacturing or in the tool mold or industries like that are having their best years they've ever had. Right. So it's not as much. I want to change that narrative. It's not as much small business versus large business. It's sector based, and if we're hearing from it, it's from those sectors, not necessarily the size of the business.
Got it. Small businesses. I know we talked about like incubators and things of that nature in the past. Are there still programs that IEDC is running to help regions or communities with folks that are trying to get their entrepreneurial footing? Especially in the pandemic now, I'm sure more and more communities are probably looking for folks to launch and start businesses. What tools or resources is currently at the agency?
Sure, so that's really where the Indiana Small Business Development Center comes in. They have 10 regional offices throughout the state, and they are providing no-cost business services to small businesses and entrepreneurs who are, during COVID, they've been severely impacted, but we've also had a ton of new business starts as well. About 300 new businesses started this year, and those supports include getting tax documents together, doing a pro forma, really getting their online presence built, and that's really where the Project Hope initiative comes in, that partnership with IU, so students can help businesses start their online presence because they're a lot more tech savvy than a lot of us. And we're seeing a lot of success both through that and then with the Small Business Restart Fund, which was our direct grants to small businesses that were affected by COVID-19.
Right. Last question. Do we ever see any programs that was once ran, like regional cities ever coming back, programs like that were successful?
It's a loaded question because we love regional cities, but obviously with what's going on with the budget and the reduction, we want to be fiscally minded here as the IEDC and work within what we have now. But if there's ever a day where we could have dedicated funds to it, we would be supportive.
Great. Thank you.
Mm-hmm.
Further questions or comments? Thank you very much. Thank you for your time and for your hard work. With that, I'll call Dr. Box up to testify as soon as we get cleaned up here. Thank you.
Mr. Chairman, as we begin to transition to Dr. Box, various members of this committee have asked for information. Again, I'm asking, is it appropriate that every member of this budget committee receive information that is given to specific members? I think it's good because some of the questions were asked, others also have that same question and seek those same answers. So is there a way that those responses go directly to your office and then disseminated back out to us, or is that appropriate or not?
If there's any extra information come to the chair, we'll make sure that tries to get disseminated out, yes.
But, yeah, I understand that, but as Emily said, or whoever said, they're gonna get it to Senator Brown or Senator Milton. Should that come to you and Senator Mishner before it goes back out to us? So we all can get the
Yeah,
same information.
we'll have a conversation. I've not received any additional information other people haven't received.
Thank you.
Thank you, Chairman Brown. I want to thank the State Budget Committee for this opportunity to be here before you today to present information about some of our agency priorities, the work that we have continued to do even throughout this pandemic, and also our current and projected budgets. The State Department of Health, or Indiana Department of Health, is celebrating 139 years this year of promoting, protecting, and improving the health and safety of all Hoosiers. Our executive team consists of myself, our Deputy Health Commissioner who's with me today, Shane Hatchett, our Chief of Staff, Shane Hatchett, our Chief Medical Officer, and our 4 Assistant Commissioners. In September, we actually split one of our public health protection and lab services when one of our Assistant Commissioners actually retired. The next slide will actually give you a better idea of how our organization is structured. Of course, other key members for our executive team include our Chief Financial Officer, our Director of Legal Affairs, Director of Technology, Director of Legislative and External Affairs, Communication Director, and Human Resources. During the pandemic, we actually added a very much needed role and position here at the Department of Health, and that was our Chief Data Officer. As you look at Indiana's health rankings, and I'm sure you know, we don't compare favorably to the rest of the United States. According to America's Health Rankings in 2019, Indiana ranked 41st in the nation. Several of our key health metrics, such as obesity, diabetes, high blood pressure, and smoking, Hoosiers rank very high compared to the national average, and this contributes. One good metric on this list is Indiana's viral suppression rate for HIV, which means that more Hoosiers who are living with HIV are actually in care and receiving medications to suppress their viral load, which means that they are very unlikely to actually spread that disease. Obviously, a significant proportion of our efforts in 2020 have been directed toward the pandemic response, but I wanted to take a few minutes to discuss some other priorities that we've continued to address even throughout this pandemic. This administration, as you know, has made addressing infant and maternal mortality a top priority for the state and our agency. This year, we announced that the 2019 infant mortality rate showed a significant decline from 6.8 infant deaths per 1,000 live births in 2018 to 6.5 infant deaths per 1,000 live births. This is Indiana's lowest rate ever since we started recording this in 1900. Most encouraging to us and to me personally has been the decline in our Black infant mortality rate to the lowest it has been for the past 10 years. We've seen a 30% drop from 15.4 infant deaths per 1,000 live births to 11 from 2017 to 2019. This does reflect an incredible amount of work that is being done across the state to specifically address these disparities. Unfortunately, our Black infant mortality rate is still 1.9 times the rate of our white, so we still have plenty of work to do. Indiana's Maternal Mortality Review Committee just completed our first ever review of maternal deaths for 2018. We released that data last week at our Labor of Love Summit. I hope you received your copy of that this morning. If not, it should be in your inboxes soon. The committee's role is to review maternal deaths, those that are pregnancy associated and those that are pregnancy related, and to make sure that we determine what factors actually might have been preventable so that then the committee can make recommendations and actually recommend programming policies that can potentially prevent future deaths. The most common cause of death, unfortunately, was substance use disorder related, and we're working with Next Level Recovery and FSSA's Department of Mental Health and Addiction to convene around this specific topic. A big part of this progress is as a result of our home visiting programs that connect women to services and provide support not only throughout pregnancy, but oftentimes throughout that entire first year of the baby's life. Our OB Navigator program, which is now known as My Healthy Baby, is a legislature-funded program, and it's been a vital component of these efforts. The program engages women who are enrolled in Medicaid and is reaching a very diverse population. In 2020, we were able to roll this program out to 22 counties, which is 2 more than were initially planned. You can see the statistics here with regards to the program. Money's been granted through My Healthy Baby programs to support, and along with Safety Pin program money, to support these home visiting programs. We've also supported OB care in our OB deserts across the state in the form of advanced practice nurses or nurse midwives to provide care closer to home in our OB deserts. Smoking is the single most preventable cause of death and disease in Indiana and in the United States. In 2018, Indiana had the 4th highest rate of smoking in the U.S., with 21.1% of our Hoosiers smoking daily. Getting people to stop smoking is extremely difficult, but more than 4,000 people quit smoking in fiscal year 2020 with the assistance of the Indiana Quit Line. Based on a $1.6 million investment, an estimated $19.4 million in savings associated with saved medical costs, lost productivity, and workman's compensation could be realized. Preventing new smokers from starting is really key, and that is why the T21 legislation is pivotal to that effort. We've been working with the Department of Mental Health and Addiction, ICJI, and Alcohol and Tobacco Control to develop this messaging. As you're aware, we saw at the same time a dramatic increase in youth nicotine use in the form of vaping from 2016 to 2018. To address this, we did multiple things, but specifically from a communication standpoint, we launched Behind the Haze, which is basically focused on 13 to 21-year-olds, and it gives evidence-based messaging to dispel the myths associated with vaping and to educate teens about the risk. We used YouTube, Snapchat, Instagram, all those things which I am not on, but which the teens very much are often frequently on. We use social, digital, and traditional media. We just completed the 3rd of these campaigns for the year. Each one of those cost $375,000, and we had 42 million impressions on each one of these campaigns, which I am told is an incredible result. Our Division of Trauma and Injury Prevention remains actively engaged with Next Level Recovery and FSSA Department of Mental Health and Addiction in addressing opioid use disorder in Indiana. 2018 was the first year in over 2 decades that we saw the number of overdoses were less than the previous year. Unfortunately, in 2019, fatal overdoses increased by 4.2% from 2018. Fatal overdoses due to opioids increased 13.5% from 18 to 19. Opioids continue to be a driving force, unfortunately, in these overdoses, and from January to June of 19, we saw 577 fatal opioid-related overdoses. In that same time, in 2020, we saw 816, so a 41% increase. We know that Indiana, as well as other states in the U.S., communities have faced increased mental health issues, challenges associated with COVID-19 illness, mortality, morbidity, and also this is translated into issues with the mitigation measures that we know have been particularly hard on our youth. Our Overdose Data to Action grant helps us to fund 16 high-burden counties as determined by their overdose deaths and their overdose ED visits and their social vulnerability index. These grants provide technical assistance through our ECHO program and a total of $1.5 million. Communities may choose to focus on primary prevention, linkage to care and recovery services, and harm reduction and anti-stigma promotions, or all of the above. We continue from the Department of Health naloxone distribution to our local health departments and our first responders, which has been critical to saving more lives. Our Division of HIV and Hepatitis continues to identify cases of HIV and hepatitis, whether that's hepatitis A or hepatitis C. And B, and we continue to engage Hoosiers in care to protect not only their health, but help prevent the spread of disease. Preventing the spread and engaging individuals in care often means reaching them at harm reduction and syringe service programs. As you can see, the 12,000 plus Hoosiers living with HIV will cost $24,000 per year, or over a lifetime, about $500,000 in medical costs. Cases of hepatitis C and HIV increase with IV drug use, and hepatitis C has increased over 135% in our state from 2015 to 2019. That's double the national average. The treatment costs for this disease can range from $30,000 to $94,000, depending on if you're using the newer meds or the more established medications, and in left untreated can result in the need for a liver transplant, which, if you look at the costs from 30 days before that transplant to 6 months after, cost about $500,000. Indiana has developed a 10-year statewide roadmap to eliminate HIV and hepatitis C through collaboration with our healthcare community within our communities across the state. The plan will integrate with Dr. Kane and the Marion County Public Health Department's plan to end HIV epidemic. Indiana's plan includes input from hundreds of stakeholders across the state and 70 technical work groups. The key is early diagnosis and effective treatment. This, along with harm reduction programs and prevention programs, help to prevent the spread of disease. So really, diagnosing early, treating quickly and effectively, and then preventing new transmissions through things like syringe service programs and harm reduction programs, or PrEP medications that we can give to individuals that we know are at risk to come in contact with HIV to prevent them from getting infected. And then when there is an outbreak, a quick response. I could talk about this next topic for hours, but I won't. I will highlight a few of our key efforts with regards to the pandemic response. The response to COVID-19 pandemic has been a multi-agency collaboration with several key partners across the state, the most notable of which has been our hospitals across the state. Early in the response, having enough personal protective equipment for our healthcare professionals, our long-term care staff, and our EMS across the state was truly a major issue. Acquisition, and now, as Luke Basso told you, production of this PPE has allowed us to secure PPE for all providers at risk, and making sure that we can secure that going forward, even at times of surge. Supply lines have opened up for our hospitals, except for some of our smaller hospitals, which we continue to support, and EMS. Testing has also been critical to establish early on. Shortages in testing supplies and reagents to actually be able to run these tests hampered Indiana as well as every other state in the United States. Our lab testing network has allowed Indiana to test at a rate higher than the U.S. average, and also allowed us to allocate specimens, continuously changing on a day-by-day basis to make sure that we can try to achieve the best turnaround times possible. Contact tracing rapidly overwhelmed the ability of our local health departments to be able to contact trace on their own, so we developed a centralized contact tracing program with a third party. This centralized team, in collaboration with our local health public health contact tracers, has worked to keep up with the expanding numbers of positive cases even through the current surge by adjusting the process for how we do contact tracing. And the Indiana Department of Health has provided countless numbers of webinars, meetings, consultations to schools, local health departments, hospitals, and providers and businesses, just to name a few. We're now engaged in what is probably, and I would say definitely, the most important part of this response, and that's the ability to get vaccine to Hoosiers all over our state. This is the key to ending this pandemic in our state. Once again, many agencies across state government are engaged, and we're grateful for our partners at the Hospital Association, who are, of their own free will, vaccinating individuals without any support financially at this time from the state. Data acquisition and analysis has been key to being able to direct policy and recommendations across the state. And we have had multiple partners from other agencies and also an external consulting company involved. When we look at the pandemic spending, the spending across the various pools of financial resources like the CARES Act dollars, the ELC grant, all of these are different buckets, and no one particular bucket was used for just one thing. Thus far, as you can see, the majority of our expenses here fall within the specimen processing and collection functions, which is what we would expect at this phase of the pandemic response. This includes costs associated with activities including PPE, testing, courier services to collect, and actually being able to run these specimens at the labs. The next function would be that of contact tracing. As I mentioned, we developed a centralized contact tracing program where all of the positive labs not only went to our local health departments, but also to the centralized platform. And we had a platform that our local health departments could engage with as we engaged centrally here at the state. We immediately sent a text out to these individuals, and if we did not hear from them within the first 4 hours, then started trying to call those individuals. Our most recent thing is with the high numbers, we've actually decreased the length of our interview and actually made this so that now at the end of this week, we'll be able to have individuals get online and fill out this complete questionnaire online and give their contacts based on that. Data analysis and sharing includes the collection of analysis of the data and analysis of the data and the methods that we use to communicate that across the state to our local health departments and to our communities. We've had local food and nutritional support primarily through centers on grants through local food banks and have partnered with FSSA on this. We have had food and nutritional support, about 6,600 increased WIC community provided to 6,600 additional people in the community. We have also had costs associated with a prevalence study that was done in conjunction with the Fairbanks School of Public Health to help inform policy. And the Indiana Department of Health actually became frontline providers through this response, running testing sites in rural areas as well as many of our high minority population areas to make sure that we were testing communities that were at highest risk. To date, this has been mostly testing for COVID going forward. As we use our mobile centers in our 10 emergency preparedness districts, this will be mostly for vaccination. When we look at health equity, which is a very important part of our discussions for all of our programmings now, it's the goal that we have set to try to help every Hoosier be able to obtain his or her best health. We know that health inequities can affect not only the individual's quality of life, but also that individual's length of life. The State Department of Health is working to ensure that social determinants of health, which may account for as much as 80% of an individual's health, are addressed in our grants and in the way we design our systems and our programming. We're partnering with our local communities to connect Hoosiers to services like food, housing, job training, and education. And as we do this, we know that we will develop a more healthy, educated, and job-trained community workforce. Equity has been added to the core of longstanding 10 public health services, which is fundamental guide for our local health departments, and this nationally is recognized as a framework to help ensure parity of services across the state and the United States. On the next slide, I just want to mention a couple of things. I think one of the more important things that we have done is to help support student loan repayment services, and this specifically is to try to help get more critical need personnel and into critical need areas of the state. We actually, as an agency, gave $600,000 to this, and the federal services gave us an additional match to that of $600,000, so about $1.2 million was given to providers. 50% of those individuals are providing behavioral health services, with 14 clinicians providing substance use disorder services full-time. 2 awards were made to nurse midwives and 1 an OBGYN physician to be able to address some of our OB deserts across the state. Our primary care clinicians made up the rest of the cohort, which is critical for providing care, especially in our rural areas. This workforce has been critical during this pandemic response, and we've been very pleased that that has gone well. In the past 2 years, Indiana has actually also tripled our national diabetes prevention participation across the state, which is critical because diabetes is one of the #1 causes or contributors to death in the state of Indiana. Shane and I also want to provide you 4 key agency updates, and I'll do the first one, and then Shane will take over. The Department of Health continues to partner with key stakeholders to address sickle cell in our state with our Minority Health Coalition and the Indiana Hemophilia and Thrombosis Center. We actually grant the Indiana Hemophilia and Thrombosis Center to make sure that we are providing for families and adults recently with sickle cell. 45 Hoosier infants are born each year with sickle cell disease or another hemoglobinopathy. Those 87% of them are actually localized to Allen, Lake, Marion, and St. Joseph County. We've been able to expand education, follow-up services, and access to pediatric hematologists in these high-need areas, which has been critical, and also make sure that they have access to this transcranial Doppler ultrasound screening, because individuals that are not treated and screened, about 10% of children by the age of 20 will undergo an ischemic cerebral infarct, or a stroke, basically. The report that the IHTC has done over the past 10 years with regards to the demographic information for children born with hemoglobinopathies is the first of its kind here, and is going to serve as a great baseline going forward to not only show us what data we do have, but gaps in data that we need to make sure that we are accessing in the future. Shane?
Thank you, Dr. Box. So in addition to the initiatives that Dr. Box talked about with the pandemic, as well as other agency priorities, we've also been working on replacing our current vital record system, which is almost 20 years old. The current system is limited in functionality and does not address our current needs or those of our local health departments. So we are embarking on a new system in partnership with LexisNexis, which will be launched early next year. This fall, we began training and are now putting the final touches on and look forward to working with our hospitals and physicians who use this system. The department's current strategic plan expires at the end of the year, so we're in the process of adopting a new one and updating our state health assessment, and our state health improvement plan will be updated next year. These two documents will be aligned to the new CDC's Healthy People 2030 national targets, so we're making sure that our metrics are aligned to the most current ones available. These documents, in addition to being best practices, are also a requirement as part of our public health accreditation, which we've been working on for several years. They formalize our strategies and relationships with the communities that we serve, oftentimes developed in conjunction with our local advocates. With respect to public health accreditation, we've been working with the board that oversees that process, and we are near achieving that status thanks to the hard work and years-long effort of our team. We expect to join the ranks of 36 other accredited state health departments next summer when we submit our final documents. For some time now, we've recognized the need for a consolidated data office and a comprehensive plan to provide agency-wide support for analytics. The COVID-19 pandemic highlighted this gap, and we were able to leverage funding to make this happen. This office fits within our strategic goal of creating a data-informed culture and policymaking throughout the department. Our chief data officer and some staff are currently funded by COVID grants, but we feel strongly about this work, and we'll look at creative ways to support it ongoing so that we can continue to answer important questions about this pandemic, public health generally, and be prepared for the next emergency when it arrives. Over the summer, the department crafted a budget submission that holds the line on key programs and protects core essential public health services. Like other state agencies, we're not immune to the fiscal challenges of the future, and this budget reflects those realities. As you can see here, our base appropriations for state fiscal year 2020 was $117.3 million. Using that as our starting point, we applied budget instructions and on our general and dedicated funding appropriations, which put us at $102 million. However, we have submitted several change packages here that we'll outline in a moment that bring our request back up to almost $110 million for each of the upcoming fiscal years. In aggregate, 68% of our $366 million combined budget comes from federal funding and grants. Our grants awarded to us have increased over the past year substantially, which has allowed us to expand our resource pool. As far as appropriations, however, general funds account for 8% and dedicated funding sources are approximately 24%. Most of our dedicated funding comes from the Tobacco Master Settlement Fund. As I noted, the department was judicious in its ask for its budget, but we did have a couple change packages that were submitted. We evaluated spending for the Children's Special Healthcare Needs Program, which is currently appropriated at just over $10 million a year. However, each year we end up spending closer to 14 or 15 million based on the needs of the program. Today, when the appropriation is exhausted in the fiscal year, we have to move additional dollars around to supplement the remaining expenses, and when that is no longer feasible, we pause paying the invoices until the next fiscal year, which creates follow-on delays and impacts claim timeliness. Funding this package will result in timely payment of claims and fully funding the program based on current needs. Next, the Medicare/Medicaid Certification Fund is used as state match for our federal funds that cover our surveyors and our regulatory divisions. As you can see from this pandemic, having a full staff of surveyors is critical to ensuring quality health care and ensuring that our regulated facilities have safety levels adequate to support them. So we're asking to bring this back to the state fiscal year 2020 funding levels accordingly. These two local health department funds were brought back to statutory appropriation levels as they direct state money to the local health departments. Any reduction in appropriation would have meant a direct reduction in state money available for the delivery of essential services by local health departments, and this request brings those appropriations back to current levels to meet the requirements set forth in statute. While not formal change packages, we did feel it important to highlight our efforts to preserve the appropriations and access to these two funds outlined up here. The Minority Health Initiative and Epidemiology funds are used for various planning projects and initiatives such as community-based programming, minority professional recruitment, and promoting culturally and linguistically appropriate health and disease prevention programs. These services are core to our work and our partnerships in the community. Additionally, community health centers care for more than 500,000 Hoosiers across 120 locations throughout the state and are available to anyone regardless of their ability to pay. Community health centers are particularly critical to populations that historically have had difficulty accessing care, including racial and ethnic minorities, refugees, rural residents, and the working poor. Of note, the CHCs employ over 2,600 medical professionals in many rural communities and oftentimes are the only primary care health providers in those communities. We've identified two additional recommendations that are not change packages but will help reduce administrative burden at the department. The first is changing the statutory language for using tuberculosis hospital funds, which are currently restricted to inpatient admissions. This no longer matches up with the clinical care standards, as many TB patients are treated in outpatient settings, which is more effective and efficient. The TB hospital fund could be used to offset the general funds currently used for these costs. Secondly, the department has more than 50 funds with specific purposes. A thorough review by our finance team this summer identified that 16 could be consolidated into 7 funds with similar uses. We'll continue to evaluate our chart of accounts for additional streamlining and look forward to this first step at consolidation. I know that a lot of information was thrown at you in this short period, but thank you, Mr. Chairman and members of the committee for your time. Commissioner Box and I certainly are happy to answer any questions that there are.
Questions? Mr. Jackson.
Thank you, Mr. Chairman. Shane, when you were talking about the children with special health care needs change package there, could you kind of talk for a minute about what's pushing those claims, kind of what that trigger is, and then a follow-up question when done with that?
Sure. So the Children's Special Health Care Fund is pretty similar to an entitlement program, and the folks who qualify for those services typically have specific disease states. And the primary driver has been around, let me back up for a second. As the fund name implies, it's typically used for children under the age of 21. However, there are a couple diseases that we cover past 21, and cystic fibrosis is one of those. And as the cost of treatment has gone up for those individuals, and the good news is they're having longer lifespans, but that does mean that there's a fiscal impact associated with that. So as we see longer lifespans, we need to adjust the funding to appropriately match that need and spend.
Thanks. And you talked about kind of getting to the end of the year and needing to move money around And you mentioned kind of, maybe even holding some bills. Has that holding of bills, kind of waiting to pay them the next fiscal year, has that resulted in any impact as far as services not being provided or anything like that?
No, these are typically claims that are submitted after a service has already been provided. So to my knowledge, it's not impacted direct delivery of care, but it does impact the provider and their need for being paid timely, potentially cash flows with their practices, but not direct patient or member impact, to my knowledge.
Thank you, Mr. Chairman. Thank you very much. It's been quite a year for the Department of Health among all the departments in the state, and I think
Thank you, Senator.
so I have just a couple of questions on some of these things. I have my pages, so it's not in any order. For the change packages in the Minority Health Initiative and Minority Epidemiology piece, it says maintain current funding levels so we can conduct research. I mean, I assume you're doing that.
We are actively doing this right now.
And then with respect to vaccinations, has ever been any thought into adding broader access to vaccinations and providers from beyond what they, I mean, obviously pharmacy and get a flu shot, you can get your shingle shot, you can probably get a bunch of are there other providers who we could give access to that don't have?
And you're talking.
I'm concerned about our vaccination rate going down.
Yeah, I agree with you. And Indiana, like every other state, has seen significant decline in children, especially newborns, getting their vaccinations because so many clinics closed during this time and so many local health departments closed. And if they were open, they were so busy responding to the pandemic. So that certainly is an issue and a big concern to us, because to have a child or someone die from a preventable disease with a vaccine would be heartbreaking. So yes, we are working on that. Right now immunizations can be given by the pharmacy down to the age of 3, and that is a national thing that Secretary Azar put into effect. And we have actually bought additional doses of adult vaccine for influenza so that we can make sure we could pass those out and get those to local health departments, to our minority populations, through church organizations. We've had EMS and paramedicine out doing that, so we could make sure that we can cover those populations that may not have gone to get those vaccines. But certainly has been an issue with the availability of vaccines. The other thing is, Senator Brown, we see a decreasing number of VFC providers. It's a technically somewhat difficult program to do, so some people don't like to be engaged with that. So continuing to make sure that we do have access in all of our counties across the state for all of our populations, whether they're rural or minority or whatever, it's been a critical part of what we're working on.
Thank you. All right, and with respect to the Local Health Maintenance Fund and Local Health Department Trust, these funds that you're advocating and providing funding to local health departments, are there any strings attached? Do they have to maintain a certain level of funding as well?
Yeah, those funds are established in statute and have been for some time now. They do require certain maintenance of effort on the part of the local health department. So these funds are meant to be used in addition to local resources, not to supplant them.
We have a way to track that? They're actually doing what
we do. In fact, our local health department outreach office actually tracks that, and there's at least one local health department that's on the naughty list for that.
You can name them later. And then for the smoking cessation, 4,000 people quit in 2020 as a result of the quit line. How many people called the quit line?
I don't have that number off the top of my head, but I can certainly get all that information with regards to the quit line, Senator Brown.
Okay. And then with respect to, well, 2 more things. But I'd have to say with the quit line, I had this question earlier with the 211. I am concerned about the numerous numbers out there that people were to call. And I understand maybe if you are contemplating suicide, there's something maybe more specific than just 211. But we seem to be having a proliferation of various help lines out there, and after a while, I think it's overwhelming. So I really, considering how the budget on the 211 has gone up, I think we should try to be coordinating, and if they're not if it's at least in addition to, so that that 211 at least has information to send someone on and they're not siloed. That's just a suggestion.
Senator Brown, I think you'd be happy to know that our Moms Helpline, which has been a key component, we've built that out with more and more people in our OB Navigator, or now My Healthy Baby program, that is the direct referral source that we have, that we link women to on a regular basis, is 211. And our contact tracing program, not only the platform-based, computer-based program, but also our call center links directly to 211 for services. And it's the last question that we ask every individual.
Okay, good. But I think 211 should also be doing it. And finally, that was a good segue, with the OB Navigator, you know that I have some programs in my area, Healthier Moms and Babies, the Women's Care Center, that see sometimes up to 13% of the babies. They both have great successes with preterm birth weights and getting moms and babies to healthy outcomes. And particularly in the 06 zip code, which I know you've targeted up in my neck of the woods. And so I hope as we go forward that we look at all of those programs and they are as robustly funded. Obviously, line items are too broad today to see. And then my last, so that was sort of a comment, because they have provable success rates, and multiple programs like that have been in existence before the OB Navigator. There had been some concern as I had talked to your department and the rollout of OB Navigator, that sometimes they were being referred to other places in the state when they weren't being referred, first of all, to where it's geographically appropriate, and also they weren't even noting the programs that are already in existence. So thank you for looking into that. And then finally, with this most recent, I do have a little bit of concern with this most recent executive order of the elective surgery issue with respect to the government executive order. So those in healthcare know at the end of the year, it was a very difficult year in terms of postponing. You know, hospital and providers have ramped up significantly to try to catch up on missed appointments, not for revenue, but because a lot of people needed to be seen, surgeries needed to be scheduled. My concern is now we're at the end of the year, deductibles may or may not have been met, and they are off the schedule, and it's year end. And so what are we doing about that issue?
There are discussions underway to address whether that's something that we could work through with some of our private insurers to certainly see if there could be an extension of that, because I agree with you. I'm a gynecologist and everybody wants surgery, at the end of the year. Everybody wants to do that in December. So I respect and understand that, and it's certainly one of the things that went into a consideration when we did this. I really want to say that we had significant issues with staffing across our state, and the ability to be able to give some relief to not only those nurses and doctors that have been working so hard nonstop for about 8 months now during the holiday time, and to support with additional staff was the big concept behind this, and then provide additional beds, which would be within a hospital system rather than setting up potentially the need for alternative care sites or other sites.
I appreciate that concern, but I still have concerns, because even though you're in talks, that doesn't mean every plan will do that. And as I mentioned to staff, once they're off the schedule, it's not like they just get put back. Schedules are made, as you know, sometimes weeks, months, whatever it is in advance. And my other concern is hospital systems are capable of making those decisions. Beginning of this, in the spring, I appreciated it was to say PPP as well as, PPE, as well as the staffing issues, events. We weren't sure we had all the capacity. But now we know hospital systems divert on a normal basis, depending on ebbs and flow, and it's because they may have beds but not the staff. But not all of the staff you're talking about will be transitioned. Orthopedic post-op are not going to be transitioned from an ICU bed to event, nor should they be. So I guess I'm a little concerned about this coming so abruptly, and I understand we are peaks. My county, I didn't check today, but has been a red county for the last week or so, and we are definitely seeing a spread. But I am also concerned that the delay in healthcare has also, as you know, had significant effects elsewhere. there are sicker people now who do not have COVID, and I am significantly, I certainly hope that at the very least the insurance companies, but that's kind of at the back end of this. I would have liked to have allowed the hospitals who have been in this now, probably it seems like a lifetime, to been able to make.
Representative Porter.
Thank you, Mr. Chairman. Just a couple of quick questions. Shane, in regards to the page 21, the vital records, new birth, was that done with local health departments in mind? Were they part of this development? Because I know Indy here in Marion County, it's been a big issue with that department in regards to birth and death registries.
Yeah, thanks for that question. So when we were developing this system, we did pilot it with about 10 local health departments who use the state system today. I do want to note, however, that Marion County uses their own local health department system for vital records and would not be using this system directly. And they're not alone in that. There are multiple health departments that have standalone systems. They do, however, integrate and pass information back and forth, and we did work with them and their vendor to ensure that those interfaces were seamless.
So they do interface?
Yes, sir.
Thank you. And also, in regards to the Minority Health Initiative and the epidemiology, I know we talked about having dollars there. I think the COVID has really illuminated the health disparities here in the state of Indiana. And I know that in working with the Minority Health Coalition, that they had dollars back in 2010 and have been cut significantly or stay stable. And I think with them being a statewide coalition, hopefully we will look at restoring those dollars that were back in 2010 and 2014. Those are important dollars that help address those concerns for the minority community, particularly communities of color. And again, I thank you so much for the Sickle Cell Initiative, which has been one of my cornerstones here in the General Assembly, to make sure that we address those needs for sickle cell trait, and working with those families. So hopefully, as we look at this budget, and you come back and brought another month or so, we can look at those numbers again, because that is very important. It's very compelling for the minority population here in the state of Indiana. It's grown significantly, but the dollars have not followed to help address health disparities within the Black and brown community. Thank you.
Representative, I just wanted to point out that you are very correct about people not knowing their sickle cell status. It used to be every African-American individual that came in my office could tell me what their status was. We still test that on every baby that's born in a newborn screen. So that's why we've been able to now include the newborn screen into the immunization records, so that every child as they grow up should be able to have access to that and actually look at their newborn screen, because it's so critical, obviously, when they decide to have a family of their own.
And I agree with you, Dr. Box. I remember that I was tested at 4th grade. I may be dating myself, but it was something that we did at 4th grade. Was kind of like go get tested,
right,
so you can know who you are, and so you don't
right,
do what you're going to do.
Or at least you can make an informed decision when you
right,
decide to have children of your own.
Exactly. Thank you.
Senator Melton.
Thank you, Mr. Chairman. And Dr. Bosch, just thank you for your leadership. I know it's been a very tough time, so I just want to acknowledge you and the work of your team. We appreciate you.
Thank you.
We appreciate the time that you spent with the Black Caucus when we met with you and the governor as well, and the conversations we wanted to address in our communities. So thank you again for that. One of the questions I have is in regard to the vaccine. Are there any plans for education or outreach for folks that may be skeptical of taking the vaccine?
Yes, we've been able to work with the Minority Health Coalition and with communities across the state to do a survey and find out that about 11% of our African American population say that they will take this vaccine. So we know what we're working with. Originally did that with our long-term care staff and went from about 20 to 25% to 45% with education. So we are working on a statewide campaign which will engage local leaders, whether those are faith-based leaders, elected leaders, local public health leaders that have already stood up and said, hey, I want to help to get this information out to my community, and that will be rolling out soon.
Great. And how successful has in your opinion, the contact tracing have been? I've seen some states or communities, like, for example, Washington, D.C., they're leveraging using technology, like an app on your phone that kind of triggers, let you know the folks that's been around you that you may have contracted COVID. Do you find those helpful, or, you know, what's some thoughts into that?
We had some discussions around that and felt like that if we instituted that the Hoosiers would feel that was even more of an invasion of their own privacy than already being called about their positive test and already being asked for close contacts. But that is an option available to us that people could opt into based on Apple phones or other things. The contact tracing, I feel like, was really successful, especially once we got it up and running centrally and we really got it nailed down where we could work with our local public health departments. We could work on the same platform, look at the same interview and case open on each patient and fill that out, whoever got a hold of that patient first. When our numbers climbed dramatically, it became very ineffective, like some other things, or more ineffective than I was comfortable with, and that's why we made changes like pretty much every other state in the nation did to try to shorten the interview. And we're actually at this point now working, as I mentioned, to get that computerized version there. So starting at the end of this week or beginning of next week, people will actually be able to not have to wait for a phone call or call back, but they can actually get online and enter that information.
Great. Last question. I think you made a comment in terms of what was the leading cause of death in Indiana. What was that again?
Heart disease is the leading cause of death, but the single most preventable factor is the smoking that the state of Indiana does.
Okay, thank you.
Thank you very much. Appreciate all the time and effort and hard work that you do. Thank you.
Thank you, Chairman.
Okay. This time we'll have Ms. Stigdon start to step forward after we get the podiums cleaned and be able to present.
I'll start my timer so that I track and hopefully not take up too much time and give you plenty of chances for questions. Good afternoon. My name is Terry Stigdon, and I'm the Director of the Department of Child Services. And with me, I have Aaron Atwell, our Chief Financial Officer. Thank you, Chairman Brown and Committee, for having us here today. So I will just start out with our recently updated mission, vision, and values statements. Our new mission statement, vision, and values resulted from an all-staff survey and a focus group this summer. And that focus group included external partners such as providers, older youth, foster parents, and the courts. It was intentional to create an updated statement that encompassed all voices of the agency and all of those who are touched by the works of the agency. We wanted to recognize the racial and cultural inequities that exist in child welfare and begin to repair the damage that starts with who we are and who we want to be as an agency. Our values that are multi-layered and can vary in meaning from one person to another, so we shifted to plain language terms. So our values are now respect for all, racial justice, diversity and inclusion, a culture of safety, and a commitment to continuous improvement. I'll just quickly go over the Child Support Bureau, which is one of our primary divisions. The child support services are provided in each county by elected prosecutors that operate with a cooperative agreement with the Child Support Bureau. Our Title 4D child support services include locating parents, establishing paternity, establishing and modifying child support and medical support orders, and enforcing the payment of child support through a variety of tools. And signing up for the services are free. We have our Parenting Time Helpline, which is staffed by licensed attorneys trained in the Indiana Parenting Time guidelines. And our Kids Line provides customer support to parents who have current child support orders or need support in any step of the process involved in getting child support or paying child support. So our accomplishments, which I will try to go over quickly, in mid-July, in the process, where we're in the process of updating our mission statement, vision, and values, we created a Racial Justice, Equity, and Inclusion Advisory Council. The council has 7 subcommittees that include coverage of culture and climate, public and private partnerships, policy and practice, professional development and training, hiring and employee relations, services and resources, and then a 7th group focused on the voice of our constituents and is comprised of a dozen young adults with experience in the foster care system. There is external and internal collaboration to make real change and create an equitable and more inclusive environment for all of those involved with DCS, including our own team members, our stakeholders, families, and children. CWIS and Invest, our child support and our child welfare IT systems, are both in the design, development, and implementation phases. Accenture started work in June for the child welfare system with phase 1 rollout on target for July 1st of 2021. Deloitte started in September with phase 1 rollout, and they are on target for rollout in 2022. We were able to introduce an online child support enrollment process 2 years prior to the full Invest rollout this past summer, all during the pandemic. Due to court closures and other issues related to the pandemic, we wanted to make sure that parents could get connected to child support services even if they couldn't go into their local office. Our Safe System Improvement Team is in place to help the agency better identify factors contributing to child maltreatment and child fatalities. And this team piloted the Safe System Improvement Tool last fall with a rollout proceeding as intended during 2021. This tool is structured to identify systemic issues that contribute or fail to prevent serious injuries and deaths due to abuse and neglect. We kicked off our intake and assessment process improvement work. The focus of this value stream is to further improve the rate at which we screen in calls to the hotline and improve our process of assessments with results of timely completion, along with other factors involved with the assessment and intake process. And then the last on service is CARES Act funding for DCS service providers who incurred costs due to preparing for COVID exposures. Round 1 is complete, and round 2 request for funding is currently in process. We were able to roll out on time for us the family preservation services on June 1st of 2020, and the goal of this is to work with identified families that are informal adjustments or in-home chins in a way that keeps children safe at home with their families. It offers Hoosier families in-home services coordinated by a single provider, which promotes clear communication, enhanced stability, and measurable data. The providers offer a full array of services aimed at keeping children in the home with their caregivers when it is safe to do so. And they are reimbursed through a per diem model, allowing them to focus on outcomes rather than billable hours. In addition, we collaborated with the Department of Health to integrate access to CHIRP for our foster parents to make it available on the foster care portal, which is the personalized dashboard. This gives foster parents up-to-date real-time information on immunization records for the children in their care. And this was added to what was already in place for our foster parents, which included present medical information, school information, and court dates. Our practice model review was launched, which is used to ensure we don't stray from our practice model. We heard that loud and clear 2.5 years ago, that is where we fell short as an agency, because our practice model is our guiding principle for the agency. We created our adoption unit, focused on removing barriers to adoption and connecting more children to their forever families. And our goal was to decrease the time from the eligibility of adoption to the time the adoption is finalized to less than a year. Our current average this year is 309 days. We launched our Shared Parent Advisory Board, which is a constituent board comprised of birth parents and foster parents and relative and kin caregivers to work with us to help us identify shortfalls in our system and guide us in our improvement work to make outcomes better for the families that we work with. And we standardized and expanded the support for foster parents that we had through our licensing specialists are already in place. One grant that I'm really excited about is our Strengthening Indiana Families grant. Thankfully, due to virtual means, we were able to continue working quite a lot. And with this grant, it is designed to build up resources with communities to get families what they need to decrease the need for intervention by DCS. What we don't want is to continually to be involved with so many children and so many families. So what can we do to help equip communities to be stronger and to give families what they need? This weekend, we will have a soft opening of our first Family Resource Center in Delaware County. Excited about that. We have a site identified in Grant County, and we are in process of finding a site in Madison County. And then our COVID response was we continue to serve families in person when assessing for child safety, because you cannot assess for child safety virtually. And we provided PPE and alternative spaces to allow for parents to have time with their children when their case plan was reunification. For our people in the agency, DCS turnover has continued to decrease every year since calendar year 2017. In 2017, our turnover rate was 26.7, and currently, to date, as of November 30th, the agency turnover was 17.1%. Our family case manager turnover is at an all-time low of 15% as of calendar year 2019, with a turnover of 13.3% as of November of this year, November 30th. We are now, for the first time ever, compliant with the caseload standard established in statute. Our 12-12-13 caseload standard went from an 88% compliance on July 2019 to 103% on July 2020. And just to remind you, the 12-12-13 stands for 12 assessments, 12 families that are being served in their home, and 13 children who are being served out of their home of origin. We also completed our first value stream analysis of the employee experience. After all, employees are our most valuable resource, and we must do what we can to provide for their best experience when they're working with DCS. Some of the highlights for this value stream was we interviewed staff from all areas of DCS in each region and division to gain insight on what causes turnover, why do they leave, and why do they stay. And the team also worked to identify the future state of the employee experience and worked on an action plan that will be worked on over the next 12 to 15 months. There are several areas of focus, but just to highlight a couple, it will allow for and provide resources for all layers of leadership to address any signs of a toxic culture and revise and create a mentor role for the agency. For our COVID response, we continue to ensure the safety and well-being of children and families using virtual tools whenever possible. And systems such as the Office Tracker was used as a software that we were able to develop and use to assist in promoting the health of staff so we can continue providing necessary services. Our goals for 2022-2023, we have 4 high-level goals. But overall, the agency will continue to work on facilitating a paradigm shift that broadens our focus to family well-being and child safety so that we are focusing more on equipping families versus separating children from their families. DCS seeks to provide support to families whenever they need it, while preserving the family unit wherever possible to reduce the trauma of removing a child unnecessarily. So our 4 goals, essentially, high level, is improve the employee experience to attract and retain a diverse and high-performing workforce, to interact with families at the right time in the appropriate way and provide the best services to fit their needs through a lens that ensures racial equity, diversity, and inclusion, upgrade our IT systems, which are already in progress, and implement the Family First Prevention Services Act. So to review a little bit of our data, our calls to the hotline, we saw a decline in calls to the hotline, which was reflective of children being out of close contact with educators, school counselors, and physicians, which make up the majority of our reporters. This occurred during the first 2 months of the pandemic, when the stay-at-home order was, was put in place. Our hotline makes a recommendation as to whether to screen in a call for assessment, and then that decision is reviewed at the local level as well. So there is a 2-step process to determining what calls coming through the hotline will move on to the assessment phase. Around 60% of the calls that come into the hotline result in an assessment. And what you'll see, that dip that occurs on that slide, that is March, April, and May, which was when the kids would have normally been in school or outside playing, where we had the stay-at-home order. Our state was affected no differently than any other jurisdiction in the nation due to the pandemic. But in June, they started to come up closer to what we would have expected during the summer, and have stayed pretty closely to what we would have anticipated based on prior years. So from the assessments, about currently 8.25, or about 8% of our assessments turn into actual open cases. So that is the drill down from calls to the hotline to an assessment to actually opening a case. Our current rate of kids being in care is about 4.67 per 1,000 children. In state fiscal year 2017, we were second in the nation for the most children entering care. As of June 30th, 2020, we are now 7th. And we will work with communities and other stakeholders to have resources available to families so families don't need to wait to go into crisis before they get help. There was a 29% decrease in children in care from 2017 to 2020. For our children that have been removed from their homes and are in other locations outside of their home of origin, we have also seen a steady decline. We have also focused on decreasing our kids that are in congregate care settings. Since November 30th of 2017, the number of kids in residential settings or congregate care has decreased by 29% as well. For adoption finalizations, we noticed a drop in our adoptions in 2020. That was not surprising due to the limitations placed on multiple factors that are involved in getting children adopted. In the initial months of COVID-19, it was challenging for many of our courts to be able to provide services. There were shutdowns either due to exposures or quarantines, and then having to figure out how to provide hearings virtually, and adoptions would be included in those as well. In addition, home studies are a necessary part of the adoption process, and there are challenges to getting those completed due to the pandemic. But even despite that, we were still able to see children get adopted, and in state fiscal year 2020, we saw 2,345 children getting adopted. So still good news. As far as our personnel, the number of FCMs needed to be compliant with the caseload standard will continue to fluctuate as the kids in care in the agency continue to fluctuate. So that is why if you look at that graph from June 30th, 2020, you see a little bit of a drop to November 30th, 2020. That just shows that we do not need to necessarily replace at the rate that we were replacing before. And with our decreased turnover, that's ideal, that we have less people leaving, but then the people that do leave, we are able to level the workload and still be able to provide the care and services needed to families. And then for our family case manager supervisors, the Child Welfare League of America defines the best practice ratio of supervisors to case managers as 1 to 5. This allows for proper staffing of cases and mentoring for the most difficult scenarios. And as of June 30th, our ratio was 1 to a little under 5. So we're meeting that ratio statewide. Our total employees for the agency grew, as you can see, as we looked at trying to manage a shortfall to meet the caseload standard about 2.5 years ago of several hundred family case managers and attorneys, in addition to meeting the recommendations of the Child Welfare Policy and Practice Group. It increased, but as we continue to assess what we need based on what we have, you have noticed, you can see that that number has dropped a little bit. And then Family First Prevention Services Act was adopted in February 2018 as part of the Bipartisan Budget Act. The focus is on secondary prevention. Primary prevention means that we don't know about the family at all, and they get whatever they need and don't have to interact with DCS. Secondary prevention is we know about them, but can we prevent the children from entering the foster care system? So that's what Family First Prevention Service Act is focused on. It makes federal resources available for mental health, substance abuse, and parenting classes. Research shows that growing up in a family is really the best for all children, especially those that have experienced abuse and neglect. And so this system will work toward keeping families together and children safe by providing access to the right prevention services to ensure a stable and safe environment. And in the case where a child does need to be removed for their safety, the next focus will be to make sure they are with people that they know, their family, whether it is with relatives or kin or other people that they know of in their circle. In the community. We will be implementing the principles of Family First by September 29th of 2021. We had some hiccups during the pandemic that made it very difficult for us to implement this year, so we are on target to implement by the federal deadline, which is by October 1st, 2021. Let's see. Another key part of Family First is that it calls for a child to be in the least restrictive environment if unable to be safe at their home of origin. So it really is, can we make sure that kids, if they cannot be in their home of origin, that they are with either their families or a family. So preparing foster families to care for children and provide stability in those environments, and use residential treatment or congregate care only when absolutely necessary, and only for the time limit required for treatment.
Awesome, thanks, Director. So from the next couple of slides, I'm going to cover our budget requests as well as our estimated annual savings, as well as potential federal funding opportunities that we have moving into the next biennium. As you can see on the chart above, our state fiscal year 2021 appropriation was $900.2 million of general fund. Our personal service contingency funding line item was $25 million. The budget instructions laid out a base calculation that requested a 15% holdback. That would have dropped our general fund appropriation dollar amount down to $765.2 million on the general fund and $21.2 million on the personal services contingency fund. The number of children under DCS care and the number of abuse and neglect assessments will not reduce rapidly enough to allow for the requested 15% reduction. However, we do understand the revenue as well as the funding challenges the state of Indiana faces, and we have requested a 6% reduction. That 6% reduction is again above in the chart, represents an ask of $870.5 million of general fund. Again, to highlight, this request represents a 6% reduction on the state fiscal year 21 as you combine both the general fund as well as a personal service contingency funding line items. These next two slides, we'll talk about our estimated annual savings as well as that potential federal funding opportunity that I mentioned a little bit earlier. DCS will continue to reduce the use of congregate care in accordance with FFPSA with an estimated savings of $12.3 million. We will reduce the number of out-of-home youth that are in residential facilities and the time spent there by 10%. We recognize that residential is the most expensive but not the most effective form of placement. We will continue focusing on intervention for the right child at the right time, resulting in the following savings. We will continue to reduce unnecessary screenings by 15%, resulting in an estimated savings of $7.9 million. Essentially, less assessments equals the need for less assessment FCMs. DCS recently completed a value stream analysis. We examined our intake process to determine and identify areas where we can eliminate waste. Sometimes that was as simple as not sending duplicative reports, saving time for our hotline workers, as well as getting information to local offices more efficiently. Next, we'll continue to reduce our non-residential service spend by 3%, estimating a savings of $10.1 million. With less kids in the system and us promoting better coordinated care equates to less service spend. Last bullet on this slide is we'll continue to reduce cases, resulting in the need for fewer permanency employees with an estimated savings of $5.2 million. With a continued reduction in cases, resulting in the need for fewer permanency FCMs. With our caseload goal of reducing that caseload by 6% down to 19,500, we believe that we should be able to reduce our permanency FCMs by that same figure. Our last slide, again, will highlight estimated savings as well as a potential funding opportunity. On October 1st of 2020, DCS issued a new comp time policy for all of our non-exempt employees. For a number of years, we've only allowed overtime. A lot of our FCMs are new. That results in the ability to take less time off. So the comp time policy will allow them to then earn that comp time policy instead of paying overtime to then be used for sick or personal or vacation time or whatever they prefer. Next, we've got the opportunity to seek the federal funding certainty grant. The Family First Act authorized funding certainty grants for federal fiscal year 20 as well as federal fiscal year 21. These grants were only available, or are only available to Title IV agencies that have operated a 4E child welfare demonstration project. The funding is intended to replace any shortfall in the 4E foster care program. The funds can be used for any purpose specified in the 4B of the Act, any activities directly associated with the implementation of FFPSA, and any activities previously funded under the former demonstration project. Last but not least, we'd like to highlight the sunsetting of Casebook. Casebook is our current case management system. As we are planning to go live with CWIS, we are also implementing a new case management system called iKids. With implementation planning to go on with phasing in, planning to go at 6/30 of 2021, we believe we'll be able to roll off Casebook at the same time. Once we go live with iKids, we'll be able to roll Casebook off and not incur those costs anymore. So we've highlighted additional estimated savings as well as future federal funding sources that we believe will help support our budget as we move into federal fiscal years 22 as 23. We look forward to working with SBA and our other partners on achieving the goal.
Are you ready for questions?
Yep. Thank you.
Questions? Senator Brown.
Thank you, Mr. Chairman. Thank you very much. Presentation. So with respect to this family case manager caseload that the legislature required you to enact a couple of years ago, the 12-12-13 that you mentioned, at the same time, did we impose a commensurate supervisor limitation as well?
What do you mean, a supervisor limitation?
Well, we limited how many children and or families, et cetera, that an FCM could monitor, right? And
yes.
So at the same time, did we also say how many supervisors or how many FCMs a supervisor could be managing?
Yes, 1 to 5. Okay,
so I guess my concern is if you ever thought about us revisiting that, since at the time, the FCMs were, in our opinion, taking care of too many children, overseeing too many children or families, but the supervisors don't have that direct contact. And so I guess my concern is we've kind of created a bit of a monster because you've hired 200 additional supervisors and only about 200 additional FCMs, and your numbers per children in needing services have gone down, but that supervisor position is going to stay open, which I presume is also paid at a higher rate. So are there recommendations, because the FCM's caseload is down, that we can also reduce the number of supervisors? Because in a sense, their caseload is down.
Sure. So the recommendation of 1 to 5 was based on the Child Welfare League of America best practice on the ratio. And the reason that is based on the cases that the family case manager has, the supervisor does have to be aware of what is going on for each of those cases for each of their family case managers. They also do go out on visits. There is a part of our practice called reflective practice, where the supervisor does shadow with each of their family case managers on a certain number of cases per month to validate their work, give them feedback to make sure that the quality meets the standards that we set.
Well, I still have concerns with that. So as we've been through COVID, and even before that, we've shifted some to televisits, right? And so are you supportive of some of that continuing? And in a more general question, how do you track the time, especially now that you're going to comp time, how do the FCMs and supervisors track the time that they put in?
So I don't know if that's two questions.
It
could
is.
be with the comp question, but I can, I believe, answer the first part of the question. So as far as virtual visits, the virtual visits are for if there are not concerns for child safety, if the family is progressing well, that's of course made on an individual basis. We, of course, provided for virtual services, and the federal guidelines given to all child welfare agencies to allow for that to continue throughout the pandemic has continued. So that I would hope that we would be able to continue doing that even after the pandemic is considered to be over, only because having that hybrid of contact with families has been very beneficial for our families. As far as the comp time.
Yeah, the comp time, and Senator Brown, if I've got your question correct, it's how do they log in? How do we track it? I mean, from...
Oh, have you been tracking? How are you going to be tracking?
Yeah, we have been tracking, and I've got some numbers. So, I mean, since the comp time policy went into effect, you know, employees of non-exempt kind of status have earned about 6,300 comp time hours. So we do track it in our kind of PeopleSoft, our HR management system, and we're able to pull that number, and then you know, the request to use comp time would go through their manager just as it would any other type of leave.
So you've been using that tracking system all along? Not just the PeopleSoft tracking their hours, you've been using that all along?
Correct.
Okay, so then how did it happen that we had that unfortunate incident up in my area now in county where the FCM didn't do anything and was, quote, tracking that she was making visits? And the only reason I learned of that is because I believe there was a criminal. Clearly you're familiar with that.
Sorry,
I think we may be talking about
somebody behind me. I think. Sorry. You know, okay, in your county, that one situation, your Allen County, is that correct? Yes, I'm aware of that. That was prior to pandemic, correct?
Yes.
Yeah. Yeah.
That's not my question, though. You said you've been tracking them all along, so how do they keep track? I know you require your providers to keep track of increments of, I think, 15 minutes. How do you make sure and verify, particularly if you insist you need the supervisors, how are you making sure the FCMs are actually doing what they say they're doing?
So that's part of the reason why we had to get that supervisor to FCM ratio down than what it was before. It was 1 to almost 8 before. 1 to 5 allows them to provide that intense supervisory of the family case managers to make sure that that work is getting done. Is that what you were asking? Okay.
That is what I was asking. I'm not sure that I got it. Do you still have the automatic residential services pay increase? Is that still in your budget? Don't the residential services still receive an automatic increase?
There is the rate review. It doesn't always necessarily result in an increase, though.
Yeah, I mean, so the rate process goes through, and yeah, it doesn't necessarily, as the director said, doesn't necessarily end up in a rate increase.
Does your current budget include a rate increase for them?
It does, yes.
Okay, does your current budget then, and so you're continuing to increase residential. Does your current budget show an increase for in-home services?
I don't believe it addresses in-home services rate increases.
That's all my questions.
Further questions or comments? Representative Cherry.
Thank you, Mr. Chairman, and I appreciate all the work you've been doing. But one question I have, how much time or what's the procedure when you remove a child from the foster parents to back with the natural parents? What do you do to verify that they're not on drugs yet, or they have jobs but they don't have jobs and they don't have a place to live, but you put them back with I've had 2 or 3 calls recently about the placing the child back with the natural parents, and he's only been drug-free for 2 weeks, and he hid his meth in the car seat and it's terrible for putting back with the parents if they haven't been verified that they're clean.
I can't speak to individual cases, but I can follow up. If you get me the information, I'm happy to follow up on those.
I will.
Sure.
Thank you. Any further questions? Thank you very much for your time here today, and thank you for the hard work you do. Next, we have on deck Mr. Joe McGinnis with Department of Transportation. After we can come forward and be ready when they're done cleaning.
Thank you, Chairman Brown and members of the committee. Good afternoon. My name is Joe McGinnis, Commissioner of Indiana Department of Transportation. Appreciate the opportunity to be with you this afternoon. Also with me to my right is Dan Broussard. He is our Chief Financial Officer at NDOT, and we're going to kind of split duties here. So I'm going to go through the first 13, 14 slides or so of this presentation, and then I'll kick it over to Dan, and then we'll turn it over to you all for any questions, comments that you might have. So we'll get started here. Just NDOT at a glance. I know we have some new members to the committee, and welcome. Just NDOT at a glance, we are made up of 6 districts around the state of Indiana, a little over 3,500 employees. That was a number as of the end of November of this year. The fiscal 2020 budget is a little over $3.3 billion. And you can see the breakdowns there between capital program and our operating program, and also assistance that we work with local units of government around the state of Indiana. Nearly 30,000 total lane miles that we're responsible for. Obviously, anything that starts with state road, US, or I is our responsibility, and also the bridges that are attached to those roadways, which numbers a little over 5,700 bridges around the state that we are responsible for. Agency goals that we have, obviously make sure that our roads and bridges are in good, safe, functioning order, but then also we want to deliver great customer service to all Hoosiers and all motorists that use our great state. Improve safety through innovation. This is one of the key focus that I've had here at the agency, particularly over the last couple of years. And we've really made a lot of strides in improving safety in the work zone, in particular for the construction men and women out there on the road, whether they're NDOT employees or partners of our consultants and contractors. And we're also now looking at how to protect the back of the queue and making sure that the efforts are put out there to protect the motorists that may be entering, slowing down as they're approaching our work zones. Have a great communication and collaboration going on with one of our state institutions, Purdue University, which obviously has a large number of engineers for us to tap into resources, and Purdue has been a great partner in this, assisting us with Indiana Constructors, Inc., ACEC, and the many partners that we have around the state with construction. Obviously, execute our 20-year road and bridge plan is at the forefront of what we do, and making sure that it is currently fully funded and that it remains fully funded as we move forward. And also, as you've probably heard over the last couple of days, many agencies, not just those that are involved in workforce development, but making sure that we're developing our 21st century workforce. That's engineers, that's finance people like Dan and his team, that's also CDL operators, heavy equipment operators, bridge inspectors, all of those folks that make up our 3,500 plus workforce, making sure that they have the skills necessary to make sure that we can deliver in a timely and safe manner. Some major projects that we currently have going on that kind of touch various locations around the state. I-69 Section 6. If you've driven down through Morgan County lately, you know exactly what I'm talking about. Obviously, a lot of infrastructure improvements going on, particularly in the city of Martinsville area. Pretty significant project. Eventually, we'll tie all of I-69 into 465 on the southwest side of Indianapolis. Project has been going on. The beginning stages of I-69 down in Evansville obviously dates back to the Governor Mitch Daniels days. Now we're going to officially conclude the I-69 construction during the Governor Eric Holcomb days. So we're looking forward to that final completion of that project. The North Split, which I know Representative Porter and various others, we've had communication over the last year or two, in particular to the North Split project. That is, if you've seen the news lately, that is imminent. That project, we've worked with numerous stakeholders in the neighborhood, business owners, homeowners, property owners, concerned constituents. I think we went through 16 different designs or iterations of design before we finally came to something that I think everyone can live with, and working with the mayor and DPW on ensuring a nice project when we get started here in the next few days. The Sherman-Benton Bridge down in southern Indiana. Matter of fact, we have had a lot of conversation around this project in particular. It's a joint project with the state of Kentucky, or the Commonwealth of Kentucky, and look forward to construction beginning again next year in 2021. Some of our big ticket major projects that are going on or will be going on, as you can kind of see the layout over the next few fiscal years and how those projects will be cash funded, beginning with Section 6, North Split, some other projects around 465 and Marion County. Expanding the interstate capacity, that's obviously been something that has been talked about since the road funding legislation that passed out of both chambers back in 2017. And so here's some more recent projects that have been completed. These are no longer ongoing. Ribbons have been cut, roads have been open for at least the last year or 18 months or so. These projects have been completed. The most recent being the one there at the bottom, I-65, Bartholomew, Jackson County area, which I believe, if I remember correctly, was about a 12 or 13 mile stretch where we added a third travel lane on that section of I-65 down in south central Indiana. One of my favorite projects or programs that we administer here, with my background being in local government, I appreciate what Community Crossings Matching Grant Program does for cities, towns, and counties in all 92 counties around the state. Just last week, we announced the awards of the second call for 2020, and which totaled a little over $101 million, 101.5 to be exact. And surprisingly, in the middle of a pandemic, we received more applications for this call than we did in the pre-pandemic of January call. We actually had 21 more local units of government apply for funding in this call than we did at the beginning of the year. So we're really excited that we were able to push out another $101 million that the governor announced last week. And as you can see, over $800 million have gone to local units of government since the inception of this program, which was merely more than a pilot program in 2016 and you all approved in 2017 as part of the road funding plan to provide continuous funding for this program. Next level connections. If you recall, a couple of years ago, the toll road up in northern Indiana generated about $1 billion with the renegotiation of the tolls on, particularly on, I think it was class 3 or 4 trucks and larger. And you can see where those dollars have gone in particular projects. Section 6 was one of them. $600 million went to Section 6. And you can see over the next few fiscal years how those dollars will be spent with this color-coded map. Obviously, the blue being the bigger one in the out years, which is Section 6, orange being trails, flights, and broadband, and then commuter rail, which is more in the next couple of years, 2020, 2021, with the expansion of the West Lake Corridor project and the South Shore Line, double track of the South Shore Line up in northwest Indiana. And here are the proceeds. This is the breakdown on our end of construction on the counties that the toll road touches: Elkhart, LaGrange, Lake, LaPorte, Porter, St. Joseph, and Steuben counties, and how those dollars are going to be spent. Obviously, construction being the largest chunk of the dollars going out into those counties, being the blue lines there. COVID-19, I know that I've caught a couple of presentations to you all earlier today, and I think everybody is talking about COVID-19. I'll talk momentarily what that impact has been to NDOT, but I want to talk about this just briefly. This is something that we've been proud as an agency to be able to provide assistance to all 92 counties with relief. Early on in March, we started distributing PPE gear from the Armory here in Indianapolis and Stoutfield, and started using, as you can see, our trucks there, and the equipment from the National Guard, State Police, Homeland Security, Health. Everyone was involved, and it was really tremendous to be out there for a few hours the first day, actually, and see all this go down. I think the first day we had about 170 trucks out there distributing PPE gear to all 92 counties, and that work actually has continued throughout this entire pandemic, as we've not only have, as you can see, hand sanitizer, surgical gowns, and other PPE gear. We've also distributed most recently to 70 colleges, campuses around the state around the Thanksgiving holiday. We distributed their rapid tests to them as their students were returning from Thanksgiving break. This chart is something that I've grown to, I guess, not like to see, but it's something that I see quite frequent. And there were 3 or 4 opportunities that I've had when the governor's COVID press conferences where I've talked about the decline in traffic. As you can see, the pretty significant drop end of March, beginning of April, where we were seeing 45–48% decline in traffic counts around the state of Indiana. That number it's coming back. We've seen a little bit of decline, and there was a dip over the Thanksgiving break holiday. Particularly on Thanksgiving Day, the traffic was down about 30% compared to 2019 Thanksgiving. But surprisingly, freight is back up, and freight numbers, the most recent freight numbers that I have seen are actually a bit of an increase over the 2019 numbers at this time of the year. And so we're thankful to see some of those numbers go back on the rise. So what that means for us, the decline in traffic, obviously we are a dedicated funds agency, and we're solely dependent upon fuel, people driving to and from work, to and from grandma's house for Thanksgiving, to and from shopping, Colts games, wherever you may be headed vacation. And you can see the decline in what we were seeing as a decline in revenue as well from the impact with a revenue decrease during that period of time of about $54 million. As you heard me say in the very beginning, deliver great customer service is one of our key pillars and goals at the agency. And every 2 years, August, September, every other year, we engage in a customer service satisfaction survey. And this most recent one was in 2020. And so here are the results from that. Strangely enough, number 1, 2, and 3 have been numbers 1, 2, and 3 the last 6 years. So the last 3 surveys that we've conducted, all of those 1, 2, and 3 have all been the same every single time. And and interesting, the removing snow and ice from highways, which it looks like we're about to do, starting again tomorrow, by look at the forecast, is the number one most important item or service that we provide for Hoosiers. Keeping in mind, this survey is conducted in August and September when the temperatures are typically still in the 80s and people aren't thinking about snow and ice flying down. And so it's interesting that that is the number one thing that we are perceived as is the most important thing that we should be doing. And as I end every speech, I always end with my safety. As you heard me talk about safety in back of queue earlier, we are engaging in some innovative technologies around the state to preserve our work zones. But the number one thing that we can all do, and we can talk to our neighbors and to our friends and to our family members, is please put the phone down. It doesn't matter if you're rolling through a construction zone or if you're driving in the cul-de-sac in your neighborhood, it's just as dangerous. And so I always make the pitch that please put your phone down and pay attention to the road as we're navigating all of our Indiana roads.
Okay, for the, I'll call it the financial portion of our presentation today. The first slide we're leading here is with total revenues and resources. And clearly you can see from the legend at the bottom what the makeup is. And it's in the light blue there, the State Highway Fund, as you can see, has been on the increase significantly since 2017 when, as the Commissioner mentioned, the legislative approval was for the increased road funding. Also, you're going to see the federal funds that we consume, that is in the orange, and then from there, much smaller portions of revenue sources and resources. We distinguish between revenues, which we typically call traditional revenues, and resources or other things that we bring in, such as the toll road lease proceeds that originated around 2006. So you can see the curve, and despite COVID-21, fiscal 21, the current fiscal year is a record year for us. And it's largely because we are consuming some of those other resources well above what I would call the traditional revenues, most notably the lease proceeds, and then we did have some reserves that the agency had built, and we're drawing those down now between fiscal 21 and 22 very, very heavily. Looking at the next slide, this is an indication of the work from 2017. You can see quite stark. This is purely the revenue, the traditional revenue sources to the state of Indiana. And had it not been for the COVID situation in fiscal 21, you would see a natural stair step there from those years, really beginning in fiscal year 18 and beyond. Again, thanks to the efforts of our legislative body, the approval of House Bill 1001 has just been a true game changer for the state of Indiana, allowing us to do what we're doing right now. And those monies, as you saw, culminating to a record year in fiscal 21. Moving to the next slide, what we're looking at here is, and this slide should look almost identical to the revenues and resources that we just talked about. And this is an indication of where the money is going. So what you can see, the curve is as I stated, identical because all of those funds are being deployed into the capital program. We call the capital program the part of our budget which is dedicated toward the maintenance of roads and bridges, interstate widening, Section 6, I-69 and beyond. So this is where the vast majority of our budget is deployed. And once again, if you look, you can see there, just like on community crossings and anything else, construction is always going to be your biggest dollar amount. And then from there, we have the engineering and right-of-way expenditures as well. Looking at the next slide, we're going to move over to the upcoming biennium. And while there's a lot of numbers on this slide, I can make it very easy for you because if you look at the bottom there, the total revenues, and the way this slide is put together, we show the amounts for fiscal 22 and fiscal 23 in separate columns. And then we show the combined increase from the previous biennium, and then there's a percentage increase overall for those 2 years combined. So focus your attention on the very bottom row. You'll see the $521 million. That's the increase between the two biennium years and the 9.6%. If you then go to the top row of the chart, you'll see the State Highway Fund. So of the $521 million, 588 of it is captured on that first line. That's the driver for the entire chart. And again, that is due to the funding mechanisms that were put in place back in 2017 that we're enjoying today. Those monies continue to go up because NDOT is continuing to get a bigger stake of the gasoline use tax, which is extremely beneficial, and we're continuing to forecast increased traffic volumes in the outer years despite COVID. We think that fiscal 22 is going to be a year that kind of returns things back to normal. Now this next slide is the pie chart that really reflects the entire agency, including the capital program and our operational budget. This slide can be pretty well summed up by the three largest pieces. You see the capital program there, which is by far the largest component of our budget, 61.3%. Then we use a lot of federal aid as well as matching funds for that federal aid for the local program, and that makes up the second largest piece of the pie, which is 15.6. And these are purely dollars being spent in the capital side of our business, meaning roads, bridges, maintenance, constructing new assets, and so on. And then, of course, the third and least piece is, in terms of the total pie, just under 9%, is the labor and benefits at NDOT to run it all. If you combine all of those, you've got 85.6% of the entire pie summed up right there in those. We're very proud of that bullet at the very bottom in that billboard. It talks about 92% of NDOT transportation expenditures. We've been holding at that percentage for some time now. And what that means is that 92 cents on every dollar that we bring in is dedicated actually to the actual transportation surface program in the state of Indiana. The other 8% would be things like your overhead, your finance organization, your MIS organization, things that we would not put in that classification. Turning the page, we now take a more finite look at just the operational budget. So this is just the NDOT footprint itself. And once again, you have a similar phenomena here where you can take three pieces of this pie and you'll come up with over 90% of our spend. Labor and benefits is the largest. The second largest is the maintenance work program. So that is where we purchase the salt. That is where we actually deploy our own resources out on the roads to do our own maintenance, such as guardrail repairs, herbicide treatments, mowing the right-of-ways, things like that. And then finally, the last piece there is sort of the overhead bucket, and that is made up of supplies and fuel. We consume a lot of fuel, especially when we're plowing during the winter season. Those would, again, those three areas would make up the vast majority of our internal budget, which is $539 million per year. So that pretty well concludes what we had for you today. I think we'll open it up for questions.
Questions? Senator Mishler.
Thank you, Mr. Chairman. You mentioned Senate Bill or House Bill 1001, and I remember when we raised the gas tax, you know, the message was finish what we started, maintain what we have. And at that point, the two projects we'd started were 69 and 31. And I know we forget promises over the years, but I see 69 and I don't see 31 anywhere. And in the 19 budget, I did not support the rails, trails, flights, whatever. And but I was assured that we would continue moving on 69 and 31. And again, I don't see 31. So was that a sales pitch to get me to support your trails, rails, and flights? Can you explain that to me?
Yeah, sure. Senator, thank you. I continue to have numerous conversations with folks, particularly local elected officials on 31. Most recently, we had a meeting at Grissom there in Peru. A couple of legislators, actually, Stacey Donato and Ethan Manning were there. Former legislator Bill Friend was also present. A mayor, at least 3 or 4 county commissioners from various counties. So it seems that, and this was a conversation I had with Paul Wyman yesterday, who's a Howard County Commissioner, particularly about 31, was there's a much different landscape as you travel up and down 31, which I know you do on a very regular basis, and what the local elected officials perceive or want for their section of 31, we have all determined is vastly different. What Hamilton County or Tipton or Howard County perceive as what they need is far different than what we're hearing from Marshall and Fulton County, for example. And so continue to work with the local elected officials on what is the best outcome and projects for this. And so there are some additional interchanges currently planned. And as you know, there's a rail crossing in Tipton County and then one up in Marshall County that will be eliminated in the next couple of years. I think one of the contracts may have already let, or it will be letting, the one in Tipton County. In addition to, there's a couple of interchanges that I can run off the top of my head right now. There is also a J-turn there in front of Gallahan Oil there just north of Peru. It was actually requested by them specifically for the J-turn, and everyone that was in that meeting agreed. And then in addition, because this is at the forefront of a lot of the infrastructure conversation I have with Governor Holcomb and his Chief of Staff, Earl Good, you will hear more from him on his agenda rollout, which I believe is Thursday. He's going to have some more descriptive examples and planning that he wants to see on US 30 and 31 in northern Indiana as well. We're not ignoring you, I promise you, and I would love to sit down and have that conversation with you in the next few weeks.
So I'm getting pressure on 30, and I keep saying, hey, if the goal was to finish what we started, and we haven't even finished 69 and 31, and now you're pushing me to start on 30. I mean, how do I?
That's right.
How do I come back and say, yeah, let's move on 30 when we can't even finish what we've already begun?
Right. Yeah, and I believe there's a meeting later in this week, actually, with particularly on 30, with some business leaders in the Fort Wayne region, not just specifically Fort Wayne, but outside in the region. I think Senator Brown probably maybe even have more information than me on that specific meeting. But that is coming up in 2 or 3 days, and kind of the outlook of what US 30 could look like over the next, like we've been saying on 31, the next 15, 20 years.
Further questions? Senator Brown.
Well, I wasn't going to chime in because we are having this meeting, but I have to echo Senator Mishra's concerns. I certainly would like to see progress on 30. I certainly wouldn't want to queue up in front of the chair of the Appropriations Committee on 31. I think it should be finished first. But I do think, particularly learning that, I applaud the retention and move of Bronco, for example, but in my mind, those were transportation dollars. And I appreciate the suggestion from Senator Mishler, who mentioned earlier this morning, using the flight money instead, because, it's appropriated, but gee golly willikers, those of us in Northeast and North Central Indiana have a lot of transportation needs, and I think could certainly say we are the crossroads up there. And although I appreciate the economic development projects, for example, it seems like perhaps there could have been another pot of money to do that, and it stings just a little bit now knowing the source of those funds, to know that it came from a really large transportation pie, but would have had a significant impact impact on our neck of the woods and certainly on 31. So I hope that we are going to see not just a continuation of the discussion, but something inked as to what is actually going to happen up in our neck of the woods.
Representative Hamilton?
Thank you, Chairman, and thank you, Commissioner McGinnis, for your presentation. First, I have a comment. I just want to share that I had a good experience working with your department on the Clear Path project in regards to putting up a sound barrier in an area where it was really important and wasn't originally the plan. So thank you to you and your folks for that. I have a question about bike and pedestrian connectivity and trails in regards to your overall investments and your work as a department. And I'll give an example. When I see the slide on the community crossings money, it prompts the question: is there any scoring related to including that connectivity, or any opportunity to require that, and anything else your department's doing in those regards?
Yeah, in particular, to community crossings, the way that we have managed that program really since it was solidified in 2017 has been taking care of Main Street, Indiana, taking care of the roads and bridges in our communities from a maintenance standpoint and perspective. At some point, this is just my hypothesis, that we will start to see a decline in the number of applications, or at least the request of dollars, because we're never going to see a decline out of Indianapolis, for example, or Fort Wayne or Evansville or South Bend. Where we will, in my opinion, we'll start to see is some of the smaller, medium-sized communities that have received $1 million in 2020, for example, and that pretty much take care of all of their needs for the next 3 or 4, maybe 5 or 6 years. And my hope is that when we start to see some of those declines, then we can open up some opportunities for more funding available for larger cities, which could include capital projects. Right now, it's purely for operations, and not operations, but purely for maintenance and preservation projects, potentially for capital and for some of those multimodal type connectivity projects.
Thank you. And I guess also that prompts me to ask about, you included Next Level Trails as part of the slide, but DNR manages that.
That's right.
Is there anything else that you do grant-wise in relation to trails?
Yeah, so there are some federal programs that we administer as well through the metropolitan planning organizations around the state, or if, for example, we just had a call that ended this past week for the rural program, so some of your smaller communities that aren't in more of an urban or suburban type setting. And there are funds available that are specifically set aside for those types of projects. So alternative forms of transportation, congestion mitigation, air quality, those types of projects will fit into those categories, and those funds do go towards, in particular, go to trails. And they can be quite lucrative. As a past local elected official in the city of Franklin, we received a few of those grants, and they were very helpful for us as we were building out several miles of trails over a 3 or 4 year period.
Yeah, well, I'm sure you know as much as anyone then the economic development, public health,
huge.
Community value of trails. I guess
especially during the pandemic, people want to get out.
Especially during the pandemic.
I want to get out. I want to ride my bike. I need to walk the dog.
Right.
I need to push a stroller. Let's go.
And trail usage is up significantly since March in Indiana and across the country. I didn't mention to you, I mentioned it previously to DNR, but Senator Melton and Senator Cruz and Representative Cook and I launched the Indiana Legislative Trails Caucus back in March. So however we can work with you to be helpful in that regard. And I just, final question to you, do you see an opportunity or the ability to increase trail funding through your agency or as a state?
Yeah, obviously right now it's tough to speculate. As you heard from Dan's report, as we're muddling through the COVID and the decline in traffic and making sure, as you heard from Senator Mishler, taking care of what we have and then finishing some of those projects, US 31, that are still out there and outstanding. And so I would love to be able to see those types of things. And, we're also taking a step back and looking at, added travel lanes on interstates. With the decline in traffic, more people are remote working. Is that a permanent thing? for large and small employers around the state. And so trying to assess what those demands and needs are going to be over the next 10, 15, 20 years, I think is extremely critical for our agency.
All right. Well, thank you. I think we have a new friend at the head of the federal DOT now, it sounds like.
I think it sounds like we might, yeah.
Thank you.
Which would be good for Indiana.
I think so.
Yeah.
I hope so.
Mr. Jackson?
Thank you, Mr. Chairman. First of all, I just want to acknowledge Dan for a minute. Dan Broussard, how long have you been with NDOT?
11 years yesterday.
Okay, and Dan's retiring at the end of the month, so congratulations to Dan. Oh.
Thank you. Thank you.
With that said, I'm going to throw you a curveball here. Hey, I just noticed that this is, when I look at the major moves construction appropriation, we've got a number in 22 and no number in 23. Does that mean that we finally obligated the last bit of major moves funding?
Yes, we're pretty well draining it. I think the intention, Zach, is to leave 25 million as a rainy day, but everything else will be liquidated. So yes, it's pretty much coming to an end.
Okay. Further questions, comments? Thank you very much, Mr. McGinnis. Thank you, Dan. Thank you for your work.
Thank you.
We are now in recess until tomorrow, Wednesday. We reconvene at 9 a.m. and we're going to have our economic statement as well as the revenue forecast first. And then we will end the whole day tomorrow with a short budget committee business meeting. So again, we're in recess till 9 a.m. tomorrow. Thank you.